this moment, we're just going to pause and we have a little surprise for Maria. We're absolutely delighted that Ruth May has joined us, our Chief Nursing Officer for England. Thank you so much, Ruth, for making the time. You must be busy with Nursing Day tomorrow. We're delighted you joined us on our pre-celebration of Nursing Day. And I know it's a surprise for Maria. So we'll hand over to you to disclose all, Ruth. And we also have Maria's her nursing family with us, both Paul and Orla, who've also joined us. Thanks ever so much, Ruth, and over to you.
Thank you so much, Carol. I really appreciate it. And sorry for interrupting mid-flow there. And I do really appreciate being allowed to join you today. Maria, I want to say thank you to you. I want to say a very big personal thank you from me to you for your leadership. And today is about saying my personal thanks. I was delighted back in January 2019 to start my tenure as Chief Nursing Officer, and I had 3 priorities then, and I do now the same. The first was about workforce and how we increase the number of nurses we've got in training, keeping the nurses and midwives that we've got, and of course, attracting more from across the globe. I had a second priority of restoring and improving the reputation of nurses, as well as recognising them. And of course, nurses across the globe have done that throughout this pandemic. People have seen across every walk of life just the experience, the depth of expertise that every nurse, midwife and care staff has got. And that has been a great joy to be part of. But my third priority then was Team CNO, how we come together as a team, as a collective voice to professionally debate, professionally argue indeed, but to come out and be as one. And I'm delighted to have been working with Andrea Sutcliffe, who I can see on the line as well, and colleagues at the RCN and beyond, to making sure that we have a collective voice. But today, Maria, I'm here to say a thank you to you as part of that recognition part of my priorities. I was privileged to launch the Chief Nursing Officer Awards back in March 2019. And today I want to pay tribute to the work of Maria. I know that you've been a registered nurse now for over 30 years, of the same era and vintage as me, perhaps, and particularly of a learning disability. I know that you've contributed to the healthcare being rated in North Staffordshire as outstanding in March 19. I know too, Maria, that you are the driving force, is what people are saying, the driving force in a number of initiatives, such as developing a user and carer council, a champion education, and developing nursing strategies, increasing staff and in-service user engagement. It goes on and on. But one of the things they describe you, Maria, as a dynamic approach. And I absolutely know that is true, the dynamic approach, and one that is passionate about improving the lives of people with learning difficulties and or autism. So Maria, I'd like to give you today a Gold Chief Nursing Officer Award to say my very big personal and huge thank you from me to you. Thank you, Maria.
So response now, Maria, please.
I didn't see that one coming whatsoever. Thank you, Ruth, and thank you, everybody. This means such a lot to me. I think I mentioned that, being a nurse is a fantastic privilege, and I've had a fantastic career, a fantastic personal life. I met my husband while I was a student nurse. And we're still together, the same length of time. So that's an achievement. I think he would think that. And as I mentioned, my daughter started nursing and is in her final year, and we do call it the family business. So we're really committed to the areas that we're really keen on. My background is learning disabilities, and I've been really lucky that Caroline's given me the opportunity to kind of come back to that, because obviously I've worked in other areas. I'm absolutely delighted, and I'm really proud to have worked with Caroline, and I'm proud to work with the team that I have here and the teams I've had previous. And I like the way, Ruth, you call it Team CNO, because, being a nurse and really making a difference is around us working as teams, both nursing teams and our multidisciplinary teams. So it's so important. The whole personal aspect of the work that we do is so important in making a difference. I can't really say anymore. I just bowled over, really. That's been such a surprise, and I don't know how they managed to keep it for me, but they've been keeping quite a bit for me. And this morning, I think they kind of found that out. Just so delighted for you to take the time to come as well, Ruth. I know how incredible busy you are, and it's been some year, hasn't it, for the NHS and for nurses. So just thank you again.
Well, Maria, I know, Maria, we're only as good as our team, aren't we? And this is one of the things I will take away from this, which is how teams have come together to work across all different sectors, across all different disciplines. But today, Maria, it's about you. It's saying thank you from me to you for your leadership of our profession. So once again, Maria, thank you for what you do.
Ruth, thank you so very, very much. We're really grateful to you, and I know Maria will hold that and cherish that, and we'll really welcome the fact that Paul and Orla were able to observe that and be part of celebrating at this moment, which we have many more to come, the career that you've had in nursing. And it's very apt that this is our thank you week across the organisation. So it's a really big thank you, obviously, to Maria, but also to the nursing profession. So thank you very much, Ruth. Bye-bye. So there we go, Maria. Nice little surprise for you there. So you're on mute, Maria, because we muted you before. I think, all right, lovely. You're off mute.
Can you hear me?
Yes, thank you.
Yeah, that was certainly a surprise. Thank you, everybody that's been involved. I don't know if Orla and Paul are still there. Oh, Paul Cronin. Yeah, that. I didn't see that one coming, and it's so fantastic to have it this week as well. And it's so great to have people in the room, our leaders. There's Paul.
Orla, unfortunately, Orla couldn't get her break, so she just messaged. So they are the life of being a nurse. Couldn't even get a break to watch her mum. So anyway, she's messaging, just saying how proud she is and well done.
Isn't that lovely? Fabulous. Thanks so much, Paul. Really great.
Well, thank you for advising me.
Great. So, Maria, we now have just 5 minutes left. We were in the middle of, I think, a dialogue around the wonderful nursing strategy that you presented, and you were responding to some thoughts. I don't know if you want to have any final thoughts, or if anybody else has got any final questions or reflections that they wanted to raise at all. It feels like quite a good moment to wrap up if people haven't, doesn't it? Unless, Maria, did you want to summarise on anything at all?
Yeah, I suppose I always like having the last word, as you know, Caroline. So I just...
Don't ask me, I don't know.
So I've been told to stop saying and of course I'm working on it, thanks to Paul. But just a great thank you to everybody, and to keep up the energy and the enthusiasm for us as a profession in really valuing and being close to patients and their families, and that's really what it's at. You know, that's the most important thing in our careers, in our everyday work, and really for the NHS. So a big thank you to everybody, to keep going.
Lovely. Thank you so much, Maria. And thank you to the team that are with you there. And thank you to everybody that's joined on Teams. Big celebration for nurses today and also tomorrow, very important. And a big thank you week from the Trust. So thanks ever so much, folks, and see you all very soon. Bye-bye now.